what we do in my clinic, Vita Veda, is we do a really comprehensive set of blood work once a year, and then a smaller subsample at the 6-month mark. If we're actively working on something, maybe you start cholesterol lowering medication, then we'll check that maybe every 3 months because we're actively trying to get it done. Then we'll do that broader evaluation again once a year. Now, you could do it more often. Brian Johnson does it once a week. So there's not a one size fits all, but I think once a year, you'll probably catch issues before they start going in the wrong direction, and with enough time to change them in a way that is not just really difficult, right? They haven't gone too far off the rails. What is a good cadence for somebody, whether it's through the capacity compass or not, to check in on your strength, mobility, balance, gait, just your prototypical person, not necessarily focused on a specific area?
That's a challenging question because people are always coming to me most frequently with a pain complaint, like knee pain when I go upstairs or when I downhill ski. Their pain is their door to my physical function program. If I wasn't training for a big race, I think once a year is an adequate. It's not maybe as often as getting your teeth checked every 6 months. Movement patterns, you can change them momentarily, very quickly, but they can get carried down the wrong path. If you do the deadlift wrong for a year, then you might develop some things that regretfully you will wish you didn't. Hopefully you have some kind of pain feedback that would prompt you to seek expert help. It also depends on like how serious you are. For somebody like you, I'm thinking every year we'd go through your capacity compass. I'd give you the 3 things to raise your floor. You wouldn't need to work on them for a year, but I could give you a few things that you could practice, especially at a younger age. You do have more of a runway to improve your tissue mobility. Those plastic can take shape over the course of a year. Strength gains need 8 to 16 weeks to really start setting in. So that's what takes a little bit more hand holding. But if you're just checking on things once a year, could continue to raise your floor of those components of extending your health span.
I was thinking every 6 months.
I think you should do it every week.
Yeah. Well, fortunately, don't quite have that kind of time. I think that makes a lot of sense. And I think in some ways the dentists, they got it down. 6 months, you come in for a cleaning, and that is the standard. That starts from, I actually don't know if it's for children. I feel like nobody really messes around with their oral and teeth health, and they've done a really good job. I don't even mean that from a commercial standpoint, but from a public health standpoint, generally speaking, teeth are well maintained. I think that is a testament to a little bit of the system they've set up. And we in medicine, we're trying to correct that now with longevity. And I think in some ways, the physical therapy world is even further behind, and probably the most far behind is the mental health world, which is a real interest of mine, but all of these are connected.